Okay, today we're gonna go through how to set up the AMIA machine. First things first is I'm gonna grab all my supplies, so the solutions that I'll need, my cassette, drain bag, and make sure that I have mini caps available. I'm gonna wash my hands prior to setting up the machine. First things first, we're gonna push the on button. And it sometimes takes a little bit to load, so be patient.
Touch test to ensure the device audio and stop button are working.
This will show up every time you turn on the machine. It's just to verify that the machine's going to alarm either throughout the day or during the night when the patient is connected, just to make sure that if something was to happen, it will be notifying you or the patient. So we'll hit test. Press the stop button in front of the machine.
Did the device produce audio alert tones?
Yes.
Go ahead.
Okay, so a little couple things before we get going on setting up the machine. If you go to your menu button down here in the bottom left, there's a couple things I would like to show you. One is if the nurse changes anything with the prescription, we should check for updates if it doesn't already come through right away. So this is where you would check for updates. If anything needs to be changed in regards to the sound of the alarm,
select a setting to modify.
You can adjust the sound here or the brightness. I'm just going to adjust the time as it is off.
Set the current time. When finished, touch. You're at the Preferences menu. You're at the main menu. Verify your name.
So as long as the name is correct for that patient, we will hit go.
Enter your current weight.
We will enter the weight and the blood pressure of the patient prior to setting up. You should have a weight for that patient from earlier that day. I'm just going to put in a random number for now.
Enter your blood pressure.
So then it'll select this one. You'll have to select the diastolic to enter that number.
Enter your heart rate.
And the heart rate.
Review your program settings, and if necessary, touch Program Settings to modify. When finished, touch Confirm.
So it's going to review what the treatment is going to be for tonight. She's going to get filled with 2300 with 6 cycles. If you're going to change, if we haven't ordered to change any of the solution concentrations, we're going to go to Program Settings. We will scroll down to page 7. And one of these would be able to be selected to change and edit to a different concentration. And then you'll just have to scroll through the program and hit save. Now we'll go to confirm.
Select a drain option, then touch next.
We will always use a drain bag, so make sure that one's always connected. We'll hit next.
Gather your treatment supplies according to your program.
We'll grab all of our supplies and hit next.
Gather your treatment solutions according to your program.
We'll have all of our solutions available. So we have 2 6 liters and a 3 liter according to this treatment. We'll hit next.
Remove bags from packaging. Lay bags on table and make sure bag lines are capped, bags are leak-free, solutions are clear and not expired. Do not stack bags.
Open the front door, just pull the door toggle down, lift up the door.
On top. Do not use if the package is damaged or if the caps are not in place.
There's usually a little tear at the top right to open. You'll inspect the package. Make sure that all the caps are on. If a line is out of place, it's okay. Just make sure that it's not damaged. So all the caps are on. Everything looks okay.
Remove drain line from line organizer and let hang.
So at this time, I'm going to remove 2 lines. The treatment is only telling me 1, but I'm going to remove my drain line and my patient line because it'll help me down the road.
Close the 4 solution line clamps in the line organizer. Do not clamp the patient line.
As of right now, we only have our 4 solution line clamps, so we're just going to start with color with the red and then end with a white. If it's easier for you, you can always start with the white and end with the red as like a stop. That's okay too.
Insert the line organizer in the clip on the right side of the device.
This just slides right into this little flap here. Sometimes it'll make a noise, sometimes it won't.
Insert cassette in front door and secure left and right lines.
At this point in time, your cassette is wrapped in this little bag. So you're just gonna unravel the cassette and lay it in there and insert the tubes into the tubing guides. On the right side, there is 5, as there's only 4 tubes. You will have one open. You can always have it, you know, skipping one. You just never want them crisscrossed, as that's not going to work. So you need to make sure that there's no crisscrossed tubes.
Unfold heater bag and place in heater tray. Secure tubing in guide, making sure the port is not twisted.
There is a shiny side to this bag, so you'll want to make sure that shiny side is up and place in heater tray. Sometimes it gets a little kinked on this left side here. There's a tubing guide. You'll want to make sure that that gets slipped in there and is laying flat. Okay. Now it says close front door and heater lid. You might need to use 2 thumbs. It's a little tough sometimes.
Remove patient line from line organizer and place it in patient line holder.
So this is where our other patient line comes into play. This is our drain line. It gets really tangled. Patient line is the green one. You'll want to slide it into the patient line holder. This is the patient line holder. There's a little plastic piece at the bottom that has a sensor. If your patient line is out like this, it's going to alarm. So you'll want to make sure that it's flush. And then we'll hit next.
Close the white clamp on the
On your drain line, you have a Y sample port. You'll want to close this, otherwise you will be mad at yourself later.
Remove blue cap from drain line and connect drain line to drain bag. Plant the large sample port on drain bag.
At this point in time, you'll grab your drain bag. You'll want to clamp the big sample port, and then you're going to take your drain line, remove the blue cap and the clear cap, and spike it into the drain line, and place your drain bag in a tote or on the floor or wherever you talked about, and hit test. At this point in time, it's going to take 4 minutes to test the cassette and make sure that it's safe for the patient. You can walk away and come back at this time. Okay. So our cassette test is complete, so we're going to hit next.
Put on mask, then disinfect hands.
We're going to put on our mask because anytime we touch behind our ears, our hands are dirty. So if you've already washed your hands, then you can use hand sanitizer. If you've gone out and done something else, then you should physically wash your hands. We'll hit next.
Remove the red clamp line from organizer and connect to the prescribed solution bag.
So we're going to take our first line, which is the red clamped line, and the machine will tell you which bag to connect it to. We should have already checked our solution bags for seal, which is strength, expiration, amount, and leaks. Strength is found on the side and up at the top. Expiration is at the top right, along with amount. And then leaks, you'll just squeeze the bag. The best way to connect your solutions is to remove your pull ring. This centerpiece is now sterile. We never want to touch that. This bigger outer ring will protect that center spot if we let it sit back down on the bag. We'll remove our clear pull ring and we will insert and twist. It's a screw on. And we'll hit next.
Remove a white clamp line from organizer and connect to the prescribed solution bag.
So the next one is a blue one, but we're gonna grab a white one. So we're gonna skip the blue one and go to the white one. You might need to rearrange your lines. Oop. So we're gonna do the same. We're gonna pull off our green pull ring, let that sit there. It's not gonna get contaminated. Pull off our clear pull ring and insert and screw together. Then we'll hit next.
Remove a white clamp line from organizer and connect to the prescribed solution bag.
So now we're gonna grab our last white one. We're gonna do the same for our third solution bag. So we'll remove our pull ring, remove the clear pull ring, and screw the two together. So we still have the blue one sitting in here, as this is patient specific in particular. Some patients are allergic to extraneal, which we will cover in our training session. Otherwise, most patients do use the blue line and have an extra white line. So we'll hit next.
Confirm connected solution types, concentrations, and volumes. When finished, touch next.
So we're just gonna double check our solutions with what we have on our cart and or table, and we'll hit next.
Break frangible seal on each connected solution bag line, then unclamp solution lines.
So there's a frangible on the bag. The best way is to break it in half and kind of twist it. You'll want a bit of a gap because the machine can suck that frangible back and cause some solution slow flows in the middle of the night. And then you'll unclamp your line, and you'll do that with the following bags. And then you'll hit prime.
The system is priming. Please wait.
At this point in time, it will take 20 minutes, so if you have something else that you need to go do, you definitely can. You don't have to babysit the machine. Once it's done priming, it will be ready to be connected to the patient. Okay, to begin patient connection, we will hit next.
Put on mask and disinfect hands. Then connect the patient line to the transfer set.
Okay, so we have our transfer set here and our patient line. We're going to remove our pull ring on the patient line. We'll remove our mini cap and insert and connect. It should be nice and flush. Then we'll hit next.
Open transfer set.
So then we'll open our transfer set on the patient line, which is, if you see the half crescent moon, we'll twist it open, and then we'll hit start. So it's always gonna start with an initial drain. Even if the patient doesn't have anything in their abdomen during the day, it'll always start there. If you have any complications or issues in any part of the treatment, you can always go to your menu.
You're at the main menu. Touch a button for more options.
And you can hit the support button.
Use the up and down arrow to view the device support information. When finished, touch back.
On here you'll see the clinic phone number. We're open Monday through Friday, 8 to 5. Then you'll have the Baxter Technical Help, and that's the 1-800 number here. They're open 24/7. You can call them at any time for any sort of machine assistance. They will immediately ask you for the serial number, which is listed at the top here. And then they'll be able to help you with any sort of troubleshooting that you may need throughout the night. So we're going to show you how to disconnect and end treatment. So I'm just going to force the machine to end treatment.
Do you want to end? Your treatment is complete. Review treatment summary details below.
It'll go through a treatment summary from what happened throughout the night. Then you'll hit next.
Deviations occurred. Contact your dialysis clinic or clinician.
When the deviations occurred has come up, it will most likely come up pretty much every morning. You do not need to call every morning. We do see this in the treatment that is exported to ShareSource. So you can just disregard this notice and proceed.
Close the transfer set.
So we're gonna close our transfer set, baby blue and white. You want to hear it. You should hear a click as that it's closed, and you'll hit next.
Clamp the patient line.
We'll clamp our patient line.
Put on mask, then disinfect hands.
We'll disinfect our hands. So we'll check our mini cap, we'll check the date. It's 2022 of October, so we're good. We're gonna prep our mini cap on a safe, stable spot. And hit next.
Disconnect and recap the transfer set.
So we're gonna grab onto our baby blue and then our patient line. This is now dirty. We don't care about that, so we're just gonna toss that on the floor. We don't wanna contaminate this dark blue port. So I'll grab my mini cap and I'm gonna look on the inside of the mini cap, make sure that it's nice and moist. Arrow into the mini cap and twist. Then we'll hit next.
The system is emptying remaining solution. Please wait.
So theoretically, it won't say 86 minutes for emptying. It's just because we had force ended the treatment. So now it still has all of this solution that it would like to move into the drain bag. So we're just gonna hit pause and skip to show you how to actually take things apart. I'm just gonna force through it and say yes.
Close all solution line clamps.
So then we'll close all of our line clamps.
Open front door and heater lid. Clamp the drain bag, then disconnect the drain bag from the drain line.
So then you would disconnect at this port here, and that would just be emptied into a hopper or a shower or a toilet of whatever, whichever, and then disposed of. If the patient is residing at home, the patient would reside throw all the garbage away in their normal garbage. If the patient resides in a nursing home or another facility, the supplies should be disposed of in a biohazard container. We'll hit next.
Remove and discard the cassette with solution bags and organizer.
So you'll remove everything from the machine. Hit next.
Close the front door and heater lid. Touch the off button to turn off the device.
And we're gonna turn off the machine. And at this time, it's gonna export the treatment into our ShareSource database, where we'll be able to see all of the information from the treatment. It usually takes a few minutes before we're able to see it, but if you have any questions, you can give us a call and we can definitely look at it during the day sometime. And then once it's done, then you're good to go. You can set it up right away and the machine can be set up for later that night, or you can just wait until you're ready to set it up later that night and then connect then as well.